So 3 weeks ago, a draft opinion was leaked, which confirmed that the Supreme Court has voted and is preparing to overturn the landmark Roe v. Wade decision. So what that means is today, technically Roe is still the law of the land, but the final decision in this case is expected sometime before this July. It's devastating to see, but it's actually not surprising. We've been expecting this because in September, the Supreme Court allowed a Texas 6-week abortion ban to go into effect, which was in blatant violation of the protections of Roe. And so what would happen if this happens, if this moves forward, is that there are about 26 states in the country that are certain or likely to ban abortion. And that includes 13 states that currently have laws on the books that would likely immediately go into effect. And some states are actually not even waiting for the final decision. Some of you may have seen that last night, the governor of Oklahoma signed a total abortion ban into effect with no exceptions and an effective date of immediate in anticipation of the Supreme Court's decision. And so what this means is that in about half of the country, people will lose their rights and access to abortion. And so those states are home to 36 million women and more trans people and non-binary people who can become pregnant. And the truth is that wealthy people will always have the resources to travel and get the care they need somewhere else. And so these bans will primarily impact people with low incomes, people who are disproportionately Black, Latino, Indigenous, and other people of color. And this really is unprecedented. Of course, there have been times that the Supreme Court has reversed its own rulings in the past, but those have been times when the Supreme Court granted expansions of rights, not rolling them back. And there's growing concern that the Supreme Court will not stop with Roe. In fact, the leaked opinion itself takes aim at other hard-fought rights, including the right to marry the person you love and the right to use birth control without government interference. And so I think the important thing to understand here is that for women and for other people who experience pregnancy, our freedoms hinge on our ability to control our reproductive health. That includes our psychological and physical health and safety and well-being. It includes our financial resources. It includes our ability to participate fully in economic and social life. 50 years ago, when Roe was decided, women could be fired from their job for being pregnant. Women couldn't get a credit card without a man's signature. Women couldn't take legal action against their employer for sexual harassment. And most Ivy League educational institutions still did not accept women at that time. And so it's really a direct result of reproductive rights that women are now close to half the workforce, more than half of college graduates. Women are in every major profession and job category in the United States, ranging from the military, law enforcement, medicine, law, education, professional sports, and corporate leadership. And it's also really important to understand that a large majority of Americans don't want to see Roe overturned. Sure, people have different opinions and beliefs, but at the end of the day, when you really talk to folks, what you hear is that most people don't really think it's our place to tell someone else what to do about a decision as complex and personal as the one to end a pregnancy. And the vast majority of Americans do not want judges or politicians engaging in those decisions. And so what does this mean for your local Planned Parenthood? Well, your local Planned Parenthood is a regional organization, Planned Parenthood California Central Coast. We provide care to about 30,000 people every year at our 6 health centers in Santa Barbara, Ventura, and San Luis Obispo counties. Our health centers provide a wide range of health services, including birth control, including sexually transmitted infection testing and treatment, breast and cervical cancer screenings, vaccinations, gender-affirming hormone care, abortion care, and a whole host of other primary preventive services. Our centers provide unbiased, compassionate care, and no one is ever turned away from Planned Parenthood for lack of ability to pay. In addition to being healthcare providers, we're also educators and determined advocates. We consider ourselves lucky to be here in California, a state with a proven commitment to reproductive freedom. And in fact, in contrast to what's happening in a lot of the country, right now there are 13 bills moving through the California legislature to protect and expand access to reproductive health services, no matter what the Supreme Court does. And due to restrictions in Texas and other states, we are already seeing more patients at our Central Coast Health Centers from other parts of the country. And we're, of course, preparing for more of that in the wake of the Supreme Court leak. And so in preparation for that, we've expanded our staff, we've hired more nurses, we've hired more doctors, we're partnering with educational institutions, including those that train nurse practitioners, residency programs for OBGYNs and family practice residents. And we're also gearing up to provide travel and logistical support to patients who are traveling to help them overcome these huge barriers to care. So what I want you to know is that no matter what happens, your local Planned Parenthood is not going anywhere. We were founded over 100 years ago on the revolutionary idea at the time that women should have the information and care that they need to live strong, healthy lives. We believe that every person should have the power and freedom to make their own decisions about their own lives, and we won't stop fighting until they do. So thank you.